Hi, I'm Quincy Samus. I'm an applied gerontologist with experience in dementia care research in the community, helping people and their families with dementia stay at home. In this talk, we'll be assessing the role of home and community environments in supporting families who are dealing with loved ones suffering from dementia. The goal of assessing home and community supports is really to provide a safe, supportive, and engaging environment to promote independence, quality of life, and dignity for the patient, and also to minimize and alleviate care or stress. Assessing environmental supports is really important for dementia patients because dementia often leads to poor judgment, poor reasoning, and poor decision-making and executive function. It also creates confusion in time and place orientation and impaired acuity of the senses, including visuospatial abilities and language. Over 90% of patients suffer also from behavioral problems at some point in the disorder. These could include agitation, delusions, hallucinations, wandering, and nighttime sleep disturbances. Some examples of risk areas in the home and community that should be assessed include things like fall risk safety, wander risk, self-neglect, driving safety, risky behaviors including fraud, abuse, and exploitation, and also medication management problems. It's ideal to assess for these risk areas by collecting information from the patients, from the families, and also from doing home inspections of the environment to see the living conditions that people are living in. For fall risk safety, some of the important things to assess for are home environment hazards. These could include things like clutter, lack of grab bars, scatter rugs, hoarding. Also, people who have a history of falls, gait problems, muscle weakness or deconditioning, and also multiple medical problems could lead to falls. In terms of wander risk, it's very important to assess for the severity and neuropsychiatric symptoms of the patient, also history of wandering, getting lost, how the home is secured and set up, and how the locks of the entrances and exits are handled, and also lack of supervision during the day and at night when the person could be alone and at risk for wandering. In terms of self-neglect, you could assess for how the person appears, whether they are keeping up with their hygiene, whether their appearance is unkempt, whether they look malnourished, soiled furniture, bedding, unpleasant odors both on the person and also in their home. And also in the refrigerator, you could look for out-of-date or rotting food. In terms of driving, a very simple way to assess for potential safety issues is to ask the family if they feel comfortable about allowing a young child to ride with the person. Often that will give you a good glimpse into whether or not they should still be driving. Checking also the car for evidence of accidents or places where they have run into things. That's another good indication. History of becoming lost or while driving in familiar areas, and also driving errors and accidents and citations are good indicators. In terms of risky behavior, such as including fraud, abuse, and exploitation, there could be a history of cooking errors where they have left things on the stove and started small kitchen fires. Also evidence that they've been allowing strangers into the home or giving away money to people who they would not normally be giving money to. In terms of managing finances, indicators could be bouncing checks, paying bills multiple times or not paying, and also you should assess for evidence of verbal or physical abuse, and also ask about their neighborhood environment and whether or not it's high crime, which would put them at risk for some of these exploitations or abuse. In terms of medications, which is a very common risk area, Evidence of them not taking medicine, so screening them on whether or not how they're storing their medicines, how they're getting their medicines. Are they having to go to multiple prescribing providers to get their medicines? Are they having to go to multiple pharmacies? Checking the medicines, doing perhaps a brown bag review to see if they are taking out-of-date medicines or other effective ways of assessing for potential problems. Other risk areas include guns and dangerous objects, emergency planning, environmental danger, having a daily schedule for their daily activities, spiritual support, and social isolation. In terms of guns and dangerous objects, it's wise to find out if there are unsecured guns or ammunition in the home, knives that are in places that they could access, swords, power tools, other dangerous objects, also harmful chemicals that they could potentially ingest because they smell like shampoo because they smell so wonderful, and also assess the person for delusions and neuropsychiatric symptoms that may lead to use of or accessing dangerous objects. And in terms of emergency planning, asking whether or not the family has a plan for emergencies such as hurricanes or other disasters, asking if they have a list of medical contacts for their providers and a list of their current medications that they're taking. Also asking whether or not they have food and water storage in the home that could be used in case of electrical outages and other situations like that. In terms of environmental dangers, it really refers to how the maintenance and the upkeep of their living environment is. Are there broken steps? Is there poor lighting? Are there steep steps? Are the smoke and carbon monoxide detectors operable? Do they have infestations such as bed bugs? Also chemicals that could cause harm. Daily life schedule is very important for their quality of life and also for engaging them in stimulating and meaningful activities. To assess for that, you could ask, what is their daily routine like on a typical day? Are there activities plans that are interesting to the person and that they engage in? Spiritual support is another risk area, and you could assess for that using finding out, first of all, if they're spiritual and if their spiritual needs are being met, and then whether or not they have access to go and be involved in those spiritual activities. Social isolation is another concern in terms of loss of social network, the availability of the informal caregiving network, and also how close their families are to their residents. To give hypothetical examples to illustrate some of these risk areas, this is the case of a 88-year-old retired school teacher with early dementia living at home with her husband. She had significant memory impairment but was not yet diagnosed or treated for the dementia. She suffered also from peripheral neuropathy, vision and vision problems due to diabetes. She also had a recent unexplained weight loss. So in this picture, things to consider given her situation would be the fall risk in terms of the clutter that you can see stacked up along the walls. Making sure that people have clear, unobstructed pathways reduces fall risk. And also you can see the pet on the top of the chair. In some cases, pets may actually become a fall risk if they're around the person's feet and they don't see them or they're not able to move around them. In this particular case's refrigerator, what you can see here is a kind of messy collection of food that some of which looks like it's been there for a while. So this would be one case where it would be great to be able to get into the home and assess what she's eating and how her nutritional needs are being met. For this case, because she has mild dementia, she's still the primary person who prepares the meals. In this situation, it's very common for people to begin having cooking errors where they turn on the stove and leave the food on and it burns and can either cause a lot of smoke or also small fires or big fires. In this case, you can see that the smoke detector was actually disengaged by taking the battery out because it had been going off so many times. So checking whether or not smoke detectors are working and also possibly putting in safety mechanisms for the stove are excellent ideas and things to assess for. In terms of medication errors, she has memory impairment. She also has poor vision. And as you can see on the bottom picture, the medications are not kept in a orderly fashion. The medication pill bottles that are turned upside down are actually ones that still need to be refilled. You can see clearly that it would be very easy to lose medications in on top of the table. So checking, visually checking how people are storing their medications can be very helpful. In another example, we have a 96-year-old retired dentist with mild to moderate dementia who was living at home with his wife, who was also his caregiver. He has gait unsteadiness and syncope. He also has a persistent paranoid delusion that his wife is having other men in her room at night. He also has a tendency to kind of escape out the back door unattended and unnoticed by the family members. In his case, it would be very important to consider fall risk management, which would include things like making sure that there's grab bars in place and that they're fastened in the right location and securely fastened. Also providing shower benches or a shower bench and a shower wand may be things to assess for. And also scatter rugs, either assessing whether the scatter rugs pose a fall risk and having them removed, or either having them taped or tacked down to the floor. Other structural fall hazards might be things like door sills. In this case, in the bottom picture, you can see that this is a raised door sill that you could actually possibly put some colored tape on to increase the visibility of it. In his case also, he suffers from delusions and paranoia that his wife is having an affair. Here in his room where he actually sleeps, you can see a large sword on the wall and also a dagger on the wall. This would be a good case where you would want to ask the family if there is access to any dangerous weapons or guns or tools or knives in the case that he were to act on his delusions and cause harm to other people. Another thing to consider in this case is his proclivity to wander away unattended. One thing to assess for would be the security of the doors. In this case, in this picture, you can actually see a door chime alarm system that has been put into place that actually notifies the family members when doors are opened and gives them audio of which door was opened. So that increases decreases the risk that he could leave without anyone knowing. So in summary, these have just been a few examples of potential risk areas that you would want to assess that are related to the home and community. These are very important to consider in supporting the patients and families over the course of the illness. Proactive assessment may help prevent accidents, emergencies, and harm to the patient and also to others. Ongoing assessments of these types of supports and risk areas are needed as the needs change with the progression of the illness. Risk screening tools are available online and also in books, as well as professional home safety evaluations.